Great to have you with us. Now, the Ghana Education Service is working on a new set of guidelines which would expedite the investigation of disciplinary cases among staff. Public Relations Officer of the service, Cassandra Chum Ampofu, told me on the Super Morning Show Friday the delay in sanctioning 10 teachers for sexual misconduct, stealing and defilement is as a result of the current procedure for sanctioning. She said the service is working on changing this.
We have a code of professional conduct. Whenever you violate or you breach any of our rules, there are sanctions for you. And so in respect to what we published today, there were allegations of sexually immoral misconduct. It was investigated right from the school level through to the district, that's Esikuma or Bakwa, through the Central Regional Education Directorate. It came to the headquarters, and then it finally ended at the GES Council. So it has gone through a series of investigations, and we have come to the final conclusion that they have indeed violated our code, that no teacher shall indulge in immoral relations with a pupil or student in its own school or in any educational institution in which he performs any official duties. And so, by this action of theirs, they have also brought the name of GES into disrepute. And so, we have submitted the appointment together with 5 other people in the Eastern and then one also from the Central region as well. But let me quickly add that, when it comes to the code of conduct that we are using now, that is what we have to do. But we are also working hard. We have a new code of conduct in the pipeline very soon. If it is approved by our council and all of that, we may be using that one. And I know that with the new one, definitely some of these processes will not just keep that long, and we can quickly get to the end of such issues. I will not be able to tell you when exactly, but I know that very soon it's in the pipeline. This time, in GES, we even had a code of professional conduct for teachers and for non-teaching staff. This new one would have a common code of conduct for both teaching and non-teaching, and there are other issues that have been revised.
She also said GES endeavors to report all cases of gender-based violence to the police, but the families of the victims often withdraw them.
Let me state that we have our girls' educational units, we have our guidance and counsel units, and we have directed them that anytime we have such a case, the first is to report to the police. But again, the moment you report, the same parents, and the society in which we live in, sometimes they would go to the court and say, oh, I just don't want to go back and forth, there's stigma and all of that. They have their own way. Before you realize, they have gone to take the issue out of court, and when that happens, we cannot do anything about it. But administratively, we can't perform our function. That's what we have done.
Now, away from that story, pregnant women in the Midday electoral area in the Central Tong district of the Volta region risk losing their unborn babies due to lack of access to antenatal care. An under-equipped CHIPS compound situated in the area is unable to meet their health demands. They are therefore compelled to travel across 2 water bodies to access antenatal care, a situation which threatens their lives and that of their unborn babies. Joy News' Fred Kwame Asare visited the area and filed the following report.
Midday, Aklaya, Afulokope, Bogaji, Ntekpo, Kukudo, Zikponu, Beji, and others form the Midday electoral area. Residents here, numbering over 4,000, are mostly peasant farmers. The people here are poor, and the CHIPS compound in the area is under-resourced. The Bogaji CHIPS compound, constructed by a U.S. philanthropist, is the second oldest health facility in the Central Tong district. It renders family planning and OPD consultations in a 2-unit structure. One room is used as a consulting room, while the other serves as the family planning unit and storeroom. An additional structure initially built to serve as a ward had to be converted into a staff bungalow. Aisha Ankra, an enrolled nurse, mans the facility all alone. Moses Aukuvi Danevo is assembly member for the area.
And actually, Bogaji Chip Compound is one of the oldest, apart from Adidome Government Hospital. This is the oldest chip compound in the district. But the fact is, the place had never seen any facelift. As far as district and government is concerned, this place is being built by an NGO, Douglas, in 1985. But so far, government just brought in workers. But in terms of infrastructure, government had done nothing. It is the community. Ugaji, Aklaya, Flukope, Tekpo, Zipo, Gudo. We have been engaging in communal labor and festivals to develop the place.
Pregnant women are compelled to cross a 70-meter wide Mlagwe Lake and the Volta Lake at Mepe with a canoe and then travel by road to Adidome for antenatal care.
The interesting thing is that when it is 6 p.m., the canoe here, when it is at the overbank, that is the end. You cannot cross to access the next village. So when women are pregnant and they come there and the canoe is not at the other bank, that is the end. It will be interesting to know that some women even deliver just at the bank of the river simply because the canoe has been taken away.
This development led to some pregnant women losing their babies either through a miscarriage or stillbirth. Agbanyo Vicentia shared her story of losing 2 pregnancies.
Evanabe devie eva kulentinye kamia ado adidum nabe devie eva kulentinye ke do va wonu ka odele ntinye e kama magba ha magava cho evele ke e hanuma no ye gavajo abe doctor no nu pombi ele matele e koja lenti.
The stories of the loss of babies haunts women in the electoral area. 7 months pregnant Newemijo Stella fears she might lose her baby considering the circumstances surrounding her.
Because of the game, I know heavy and me hameli. Kajamicho time over Kai, a rocket toban me guy, go me by Gividrola. A ronamo subola, Bomochola, a water talk me fan. Miller wood and a juru of the mule bridgella. Neja got corner, Pelemienti. Now bridgella toginemi.
This has been the cry of every single citizen in the Mafia-Dove electoral area. They believe construction of an 80-meter footbridge on the Mlagwe Lake would lessen their predicaments in accessing health care, reduce loss of lives, and bring smiles to the faces of Stella and her colleagues. Fred Kwame Asari, Joy News, Mafi, Bogaji.
Now, final year students of Kokofu Nursing Training College in the Ashanti region may be unable to sit for the 2019 licensure online examination. It's because the school has inadequate computers to facilitate the exams, despite repeated calls by management on government to address the shortfall. At the school's 10th year anniversary annual circulation, Principal Beatrice Williams drew attention to the issue. Nana Sentimenta has more. This report.
The Nursing and Midwifery Council introduced online licensing examination for nurses and midwives this year to improve the old system. Established 10 years ago, Kokofu Nursing Training College has infrastructural challenges. The only 3-story building serves as classrooms and administrative offices, resulting in congestion. The most pressing challenge currently, perhaps, is limited computers for final year students to write the online licensure exams.
At the professional level and to give the highest standard of nursing care to my patients.
It follows introduction of online examination by the Nursing and Midwives Council earlier this year. Madam Williams shed more light.
But we are praying that we will be able to get at least 100 computers before next year. We are hoping. That is why, as part of our 10th anniversary celebration, we are asking people to donate. We are telling parents to give freely. We have also written that corporate bodies should also come and help us. If this situation maintains, then I'm actually praying that it shouldn't be so. But if it is so, then it means that we will have to take our students to another school for the final exam. And look at Kokofu. Kokofu is about 2 hours drive from Kumasi, right? So if we have to take probably 180 students to another school, maybe Kumasi Nurses Training College for exam, it will be very difficult. So we are praying and hoping that we know they will come and help us.
Teachers' accommodation and access road from the Kokofu town to the school are among other headaches.
Yeah, it's affecting teaching and learning. In fact, we have about 25 teachers, but we do not have any staff accommodation. The district assembly built 2 unit block for us. So currently only 2 teachers are on campus who are taking care of about 600 students. So our tutors commute every day from Feyasi, from Kumasi, from Kronum to this place. So when you have a 7:30 lecture, it means that you have to take a bus from the house. You have to set up around 4 or 5 a.m. You realize that before the teacher gets here, he's tired. He or she wouldn't be able to give much of his strength or skills.
Reporting for Joy News, Nana Asensumensa.
Now, the Commission on Human Rights and Administrative Justice, SHRAJ, has directed the Medical and Dental Council to respond to claims by Dr. Richard Ibrahimi Seidu that though he has trained as a professional neurosurgeon from China, the council has refused him an examination to practice in Ghana. According to the gentleman Richard Ibrahimani Seidu, he has resorted to driving a taxi cab for a living as a result of the frustration of unemployment. Now, Joy News came across Richard Seidu showing documents as proof of his qualification.
The medical degree in University for Development Studies, and these are the certificates to that effect. From there, I was sworn in as a medical doctor in the. I was sworn in as a medical doctor with a provisional license to practice as a house officer. While practicing as a house officer under supervision in the Volta Regional Hospital, I had a scholarship to go and read neurosurgery at Yangtze University. So I had finished 1 year of my house job before leaving. As at the time, weighing through understanding the practice of medicine in Ghana and looking at evaluating the regulations that is governing the medical body as they are written in black and white, I decided to go in to have a higher skill. The house job is to equip the house officer with basic and critical skills to be able to practice. I have done 1 year of that. The second year was what was left. I was even in the middle of the second year before leaving. Currently, I have a higher certificate that with higher skills, which is the neurosurgery certificate that I went to China to go and study for. Per this, when I came back to this country in 2015, I wrote to the Ghana Medical and Dental Council and kept an application to write the examination, the specialist examination. These are the receipts of payment of my receipt of payment to write the exams in 2015. Now, I was denied the exams. No letter was written to me as to whether my document had been received and as to whether I would even sit for the exams. I go there almost every day until I got frustrated. Then I noticed that as a neurosurgeon, I must have a world certification because it is only neurosurgery that has a world body that regulates the practice of neurosurgery, which is the Federation of World Federation of Neurological Surgical Associations. And currently, as I tell you, I have gone to take this practice, and my name has been catalogued at the headquarters of this particular association or this particular world body of neurosurgery in Geneva, Switzerland, and these are the copies. I am still a fellow in one of the most busiest hospital in China, that is the West China Hospital. This hospital is located at the west of China, and it has so many patients. While doing my practice or my fellowship in this particular hospital, I had the opportunity to treat so many diverse neurosurgical conditions in the whole world. I have written and published most of these cases. As you can, if you want, you can Google my name. You can also check up my name and ResearchGate, and all of them are publications to indicate that I actually have done so much work in neurosurgery in this particular hospital.
Let's go to the phone lines and speak with Tsar Julius Caesar, who is NUG's president in China. That's the National Union of Ghana Students in China. Good morning, Julius. Thanks for joining. Good afternoon, sorry. Julius, thanks for joining us.
Good afternoon. Greetings to all your listeners, to friends, families, and everyone listening to you.
Great. Thanks again for joining us. Now, in the first place, when you hear that a student who was trained in China is finding it difficult to get the certification he needs in Ghana, what are your thoughts?
Yeah, it's an issue that over the past few days, I think 2 days ago, this people had here in China. In actual fact, we are yet to get the full fact of the matter, except what the media has brought out. We are yet to get in touch with the gentleman in question here. But it's something of a major concern for us. Because in as much as we do appreciate the position of the Medical and Dental Council in ensuring quality in the profession, we also do think that a student like this should have a place to work in our health sector.
Now, I understand you have been engaging the Medical and Dental Council, not on this specific issue, but on the general issue of students trained in China having to come to Ghana to seek certification. What have you been learning in that process?
Yes, somewhere last year, around May, we did have a team from Ghana Medical and Dental Council and then Parliamentary Select Committee on Health. They came over to China to inspect most of the medical schools in China and go through the process of accreditation, meeting with the Ghanaian students and educating us on the current trends in the health system back home, as well as preparation for the professional exams. Of course, there were a lot of questions raised during such meetings with issues like a quota being fixed so that students or medical personnel after graduating wouldn't flood the system. They did, in fact, deny that allegation. So it was a fruitful discussion, though. But there are still concerns over the rate of failure of foreign trained personnel.
Right. Will the NUGs in China be taking any action about this specific case?
For us, like I did say in the beginning, from what we read, there are issues of whether or not the certificate is genuine. And for anyone who has studied in China, there are procedures for attestation, and that involving the union and the embassy. The embassy has a legal right to attest anyone who has graduated from China. And so it leaves us with questions whether all these processes were undertaken, whether the students have done that attestation, and whether the embassy, the Medical and Dental Council, has gone that step ahead to contact the embassy to see whether the medical school is of access, what is their structure of training, and whether he did really even complete the program.
Right. Thank you very much, Julius Caesar, for joining us this morning. This afternoon on Joy News today. Now we were scheduled to speak with the Medical and Dental Council. They agreed to speak with us, but unfortunately, they are not picking our calls now. We would take these important messages. We'll be back shortly. Welcome back to Joy News. Today, I am Daniel Daze. We are privileged to have with us on the phone Dr. Eli Atikwe. He is the Registrar of the Medical and Dental Council. Doctor, thanks for joining us.
Thank you for having me.
In the first place, are you familiar with this case of Richard Abrahamani Senu?
Yes, I am. I'm very familiar with the case.
Okay, so why has he not been allowed to write the examination?
Yeah, I think that the Medical and Dental Council registers qualified medical and dental practitioners. Mm-hmm. And there are processes that individuals go through to be admitted to write the examination at whatever level. In this particular case, to cut the long story short, the gentleman does not have the requisite qualification to really entitle him to writing the examination as a neurosurgeon.
What is lacking in his qualification?
Well, in the first place, you see, before an individual is considered to take the examination as a specialist, we look at the duration of training, we look at the content of the training, we're looking at the scope of training, we look at as to whether or not the individual in the course of the training has had any patient responsibility, and then whether the individual has even had a taught program, and whether there was a thesis at the end of the program. So there is a criteria that we use to really ascertain whether or not an individual should be admitted to write the examination as a specialist. That notwithstanding, this individual trained in Ghana, and by the rules, the individual was supposed to have done a 2-year housemanship for him to be permanently registered before he goes further to do a specialist program.
Okay.
In his case, he did not complete the 2-year housemanship. He completed a 1-year program with some difficulty, with which we had to move him from his original place of training on his own request. We moved him to Tamale, and then eventually he requested to be moved to Wa in the Upper West region, which we did. So whilst in the Upper West region, we never heard from him again. And then after 3 years, he came back saying that he went to China to go and do a course in neurosurgery, and he would wish to be considered to write the council's specialist examination as a neurosurgeon. His documents were considered. We had some interaction with him, and we made it known to him that the qualification, the training, does not meet the minimum standards to be considered to write the examination as a neurosurgeon.
Okay. Dr. Atikwe, so what was lacking with his training? Is it the 3 years that he spent out? Did he undergo a 3-year training that 3-year training is not enough? Did he have patient's responsibility?
Yeah, the issue is that, well, for neurosurgery, I am sure when we're talking about neurosurgery, that is somebody who should be in a position to open up your skull and operate on your brain. That is somebody who would have to work on your spine. And therefore, we are very careful as to whoever we go in there or we register there to do specific programs or to do specific surgeries. Now, in his case, you have asked a question as to whether the duration. I indicated that it is not only the duration. We look at the course content. We look at as to whether or not he has even had patient responsibility in the course of his training.
Did he have patient responsibility?
At the end of the day, we also look at the fact as to whether or not that individual can be registered in the country of origin or the country of training to practice at the level that the individual purports to be.
Okay.
Now, we have also found out from China, because we have a number of Ghanaians being trained in China. And we know that for you to hold yourself up as a specialist in China, after you have done your MBCHB, your primary, or you have obtained your primary qualification, you do a 3-year, then you do not have patient responsibility. You do an additional 3 years, which makes it 6 years. And then you have a probationary period of 2 years, where now you will have some patient responsibility, but under strict supervision. That is what happens in the country of training. So if you were in China, you would have done the first 3 years, done an additional 3 years, and then have a probationary period of 2 years. So that makes it about 8 years for him to be fully let out to have patient responsibility on his own. In his case, he's back in Ghana after a 3-year program. And we know that in other jurisdictions, in Germany, in the US, in the UK, neurosurgery, you need to have done 6 years. So the question is, as to whether it was fast-tracked or it was whatever, which to me, to the council, we know that with surgical procedures, we do not fast-track training.
Right. So, Doc, have we tried to verify the documents he presents as proof?
We have done everything. And I wish to indicate that, you see, Dr. Abramani claims that we have not communicated with him, or he has been left in the dark. He doesn't know anything about what is happening at the Medical and Dental Council. I have before me Dr. Abramani's file. I'll tell you that on the 3rd of July this year, I had a meeting with him in my office. And usually what I do is, when I meet with practitioners, I take notes on whatever the outcome of the meetings are. So on the 3rd of July 2018, I met with Dr. Abramani in my office. We talked about his additional qualification and his eligibility to write the council's examination as a specialist. Then he said he has done a fellowship, and he was supposed to have brought information to us on the fellowship that he said he had done. He had brought that information, and we noted that the fellowship lasted for only 6 months. That is from February to August. And I'm wondering, or I did ask him, whether a fellowship of 6 months is acceptable anywhere on the globe. Then on the 25th of September, again, I met with the practitioner, and I told him that it appears that, or he wants to take the issues personal, as though Dr. Chikwe is the one who is preventing him from writing the examination. So it will be appropriate for him to appear before the credentials committee. Then on the 16th of October this year, I met with him again, and we agreed that he will appear before the credentials committee sometime in January next year for the credentials committee to look at all that. And he was given a letter, and I indicated that the practitioner should be given a letter not later than Friday, the 19th of October, 2018. And we did that.
So, Dr. Tipui, finally, he's applying to write an exam as a specialist. Would he be able to apply to write an exam as an MD, as a GP, sorry, as a general practitioner?
I think we had crossed that bridge. It is he who doesn't want to take that. The first option that was open to him, since he did not complete his house job, was that to write the examination as a general duty doctor. Because there are others who started their house job, did not complete, they went out, came back, and they came to write the examination as a general duty doctor. That was the first option that was open to him.
Right, and if he had done that, he would be able to work as a general duty doctor in a hospital whilst he's working on this specialist qualification.
Exactly. These were some of the discussions that we had with him, because we looked at the various options. You see, because Now there is a 1 year outstanding housemanship.
Yeah.
So if he had written the examination as a general duty doctor, then the case will now go back to the education committee to really take a decision as to whether or not he will do the housemanship for 1 year or the 2 years. But in his case, where he has gone to do some additional training, I am sure the education committee wouldn't, say that he should go back doing the 2 years. The probability was that he could do the 1 year, and then we would work it out from there.
Okay.
You see, interestingly, I've had series of discussions with Dr. Abramani on this very subject. I am so surprised that it is ended up this way, but I think that once a letter has come from Shraj, we will respond adequately and attach all the requisite documents to the commission for their advice.
Will you certify Dr. Abrahamani Seidu as a specialist neurosurgeon?
Pardon?
Will you certify Dr. Richard Seidu as a specialist surgeon?
The Medical and Dental Council cannot certify Dr. Abramani to hold himself up as a neurosurgeon.
Thank you, Dr. Eli Atikwi, for joining us. He is the Registrar and CEO for the Medical and Dental Council. It's now time for Business with Sandra Esenamapenu. Stay with us.